Hello, my dear doctors. I hope so. Everyone is doing well. So today I'm going to talk about few things like uh, the job in Australia, and also I'll show you one of the hospital job website. At the same time, I'll give you a demonstration on what type of jobs are available in Australia. All right. Now let's see, this coming up thing about the job in Australia. You must be knowing there are two types of job basically available, and there are also like a lot of subtypes. So one of the job types are the GP jobs, and another job types are the hospital job. All right. So this is one of the thing. Now, for the hospital job, what are the things they are looking for? So they're usually looking for, you pass the AMC, which is very very important. If you pass the both parts, it's much better for you because you can get the provisional registration. So there are high chances that you will secure a job if you clear the both parts. Now, some doctor often ask a question, doctor, can I get a job after AMC1? That's also possible actually. It sometimes depends on the demand actually. We have already certain students, they're also working after AMC1. Those are the things usually depends on the demands, like ICU, emergency. Like these are the areas where they always need doctors. So sometimes even someone who has passed AMC1 and maybe an ICU expert, and that hospital required an ICU register. So in that case, they might be looking forward to you, and with AMC1 under the limited registration, you can get the job actually. All right, so this is the one part which many of you ask this question that after one, is it possible? It's quite possible, but you need to have certain experiences. I mind it, fresh graduates, I don't think so is fit for this kind of thing, or those are the experts, like actually according to the demands, probably the job is available. Okay, now the authentic way, I mean, you finish the whole AMC and then you apply for the job because you have a registration actually already. So that's the provisional registration. So if you have the provisional registration, like the example which I'm going to show you now, so you are fit for this kind of criteria. So now a hospital in Melbourne, where there is job things has opened up recently, and you will see very soon what type of job. These are HMO level 2, HMO level 3. These are hospital jobs that's been opened up actually. So what are the criteria, what are the things I'm going to show you by going to their website. So stay with me, don't go away. My dear doctors, like as you can see, this is the website probably we're looking forward. This is one of the example I'm showing. There's so many other job websites. Those are available for applying job. Example, indeed.com. You can also ask us, take help, and those are our academic candidates. We keep helping them. All right, now if you see one thing, like this job is related to, I'm just telling the authenticity. This job is related to like St. Vincent's Hospital, which is a renowned hospital in Melbourne. So a lot of health workers are working there. So this is the last page, and now what type of job they are looking for? It's a hospital medical officer job, and it is HMO level 2 and the level 3. Let me tell you, HMO, don't get confused, like in some of the countries like Bangladesh, like HMO is non-paid job, but these are the paid job, guys, and very highly paid, more than at least 80,000 in case of level 2, and even more higher in case of level 3. So we'll see that one. So job description they're giving, so PGY 2 and 3. So these are the hospital posts that is usually offered. Now if you go and see the next thing people usually look forward, doctor, how much salary I will get. So this is a level 2 job or level 3 job. So you see in the classification range like this one, yeah, here if you see it's like more than 80,000. So depends on your experience, your negotiation, and your interviews. They will be agreed. They can even pay you up to even a very high number. So it's everything is above 80,000 actually. All right. So some criteria they are also mentioning, like hold a AFRA registration, which I told you earlier. Also we'll make another video on AFRA registration. There's 3 types of registration: general, provisional, limited. So you need to have a registration to apply for this job. So probably for those have only MC1 and might not apply for this job, unless you have APRA registration. Maybe you are doing already in another job and you have limited registration, so in that case probably you can apply. All right, now you can see one thing you need, to like classification of PGY2 or greater means you need to fit into the selection criteria. So now that's a very big field. What is selection criteria? So there are certain points which you need to cover. You can ask us for that one. Also, some people provide services whether you are fitting for their selection criteria. Next one, police clearance. Remember one thing, any job you do in foreign countries, you need police clearance certificate. Next, full rights in, because you need to have the rights to working in Australia. I mean, job offer, or if you're already in Australia, or I mean PR, like those are PR. You can directly always work in Australia. Like you have the capability, or you are in student visa, or maybe your husband is in student visa and you are the doctor who is also living with your husband, and you also have full authority to work in Australia. So if you have PR, the higher chances. But many job you will also find even without PR, that is possible actually. So it is vice versa actually. So without PR there are jobs, with PR there are jobs. But you can understand one thing, if you have PR, there's more chances of getting this job actually, because they don't have to send you again extra papers to come here and work actually. So this is their part actually. So then they gave some, tell few things about the hospital. Then they tell about benefits, salary, so good salary, employee assistant program. So one more thing guys, you can look forward, like does this hospital has rotation shift program or not. I'll explain that one in another video, what is rotation shift program, because it's easy to get general registration in that case. So how to apply is, you see, they're looking forward to your CV, your cover letter. Guys, this has to be highly standard according to the Australia, and 2 written references preferable. These references can be in Australia or outside Australia actually. So I prefer one at least has to be in Australia. So these are the certain thing, and the contact details and the email are given, and the job circular is open till 30th of April. Understand one thing, 30th of April you can apply, but if they agreed, they can also give you more time to come here and work actually. All right, so you see options of applying. Okay, so the good hospital. Thank you so much guys.